Today is Friday, January 22nd. Welcome to this edition of Nevada County Now. Today's episode, we're talking to the new public health officer, talking polio versus COVID, the new board chair, and more. Hello and welcome to Nevada County Now. I'm your host, Cole Pettit. We've seen an increase of 185 COVID-19 cases since last week, bringing our total to 3,257 confirmed cases. 532 cases are currently active with 9 hospitalizations. Our regional ICU availability currently sits at 9%, but due to state projections, the stay-at-home order has been lifted, and we are now back in the purple or widespread tier. The death toll increased by 3 more and now sits at 74. The vaccine rollout is well underway. At this point, all people who are in Phase 1A are eligible to receive a vaccine. Phase 1A consists of healthcare and long-term care staff and includes frontline hospital staff, laboratory workers, pharmacy staff, midwives, etc. If you are in Phase 1A and you haven't heard from Public Health regarding vaccine eligibility, submit your information via their online form at mynevadacounty.com/coronavirus/Phase 1A. The county expects to be able to begin vaccinating Phase 1B in early February. Phase 1B includes people over 75, as well as education and childcare workers and emergency services. To stay up to date with the latest on vaccine information, you can sign up for text alerts by texting vaccine info to 828-211. You can also call 211 to speak to a call specialist or visit mynevadacounty.com/coronavirus/vaccine. On January 12th, the Nevada County Board of Supervisors officially appointed Dr. Scott Kellerman as Public Health Officer, replacing Dr. Richard Johnson, who was serving as our interim health officer. Today I was able to have a brief chat with Dr. Kellerman. Let's see what he had to say. Okay, I'm joined today by the new county health officer, Dr. Scott Kellerman. Thanks for joining us today.
Thanks, Cole. Good to be with you.
Yeah, so why don't you first off give people a little bit of background about who you are and how long you've been in the community and some of the things you've been doing.
Back in the late 1970s, my wife and I worked in Nepal, and we were there for 2.5 years. And when we came back from Nepal, I'm from New Orleans, my wife's from Houston. We were looking for places to settle down and practice medicine, and we came through Nevada County and just looked at each other and said, "This is it." So we moved here and spent a couple of decades. I was in private practice. I was involved with Sierra Nevada Hospital. I was chief of staff of the hospital on the board for several terms, and then Dr. Chargan and Dr. Dawkins and I got together and we bought Old Miners Hospital, and we renovated that, and it essentially became Miners Clinic and now is Western Sierra Clinic. And then in 2001, closed my practice, turned over to Doug Johnson and John Pierce, and my wife and I moved to Uganda to work with the Batwa Pygmies of the Buendian Peninsula Forest. And that was fairly daunting. The Batwa have a life expectancy to the age of 28, annual income of $25 a year. There was no healthcare delivery system, no infrastructure, no schools, no nothing. And so we're pretty overwhelmed, but along came Nevada County. And we teamed together with Nevada County. Over 200 Nevada County residents have come over to spend time, and time, talent, material, and economics have all supported us. And out of that collaboration, now we have a 175-bed hospital, which has been ranked one of the best hospitals in East Africa. We put up a 400-student nursing school, which is flourishing. It's ranked the best nursing school in Uganda. And soon it's become a full science and technology university. Education was very limited in that area. Now we have 1,200 kids in school, put up 3 schools. So that's just a collaboration of working with Nevada County, and the results of the collaboration speak for themselves. Kids are being educated, and people are being healed from the hospital, and the Batwa Pygmies are extricating themselves out of their cycle of poverty, and actually they're flourishing. So I'd like big shout out, big thank you for Nevada County for teaming up and collaborating in that effort.
Sort of watching somewhat from the sidelines of how some of the decisions have been made, some of the ways that the pandemic's been handled to this point, be that with lockdowns or mask mandates or any of the other stuff that's happened. Have you learned from some of those decisions that have been made, and does that change your approach going forward in terms of just maybe communication with the public or anything along those lines?
Tough question, Cole. Communications could have been better. It's been, it's kind of discoordinated all the way. Viruses don't know borders. Federal policy has been lacking. A lot of money has been thrown into Operation Warp Speed. Not much has been put into vaccine rollout or continuity, a policy that has continuity through all states. States have been left to themselves to try to figure out how to battle this pandemic. It's a real wrestle, but it's all about the conversation. How do we make this thing work? How do we make it individualized for a particular facility for this county following under state rules? And how do we do that? But it is all about the ongoing conversation. We have to keep talking. And where people are hurting, we try to figure out options that may work for them, still fitting within the state guidelines, because the state guidelines are very reasonable from public health. But it is all about the conversation. It's not about facts. You're never going to convince anybody about to change their mind from facts, but you will develop through relationships and communication and collaboration. Then minds and hearts can be changed. So my guess is if I'd have done it differently, I'm not an elected official, but I would have really done a lot of talking. And, you got state, you got federal, state, and then now local. And how do you carry that out under the guidelines of public health, but do it in a way that is collaborative?
Thanks, Dr. Kellerman. Best of luck in your new role. To view my full conversation with Dr. Kellerman, visit us on Facebook or YouTube. Sticking with the health theme, we were also joined once again by Kimberly Parker, Executive Director of the Sierra Nevada Memorial Hospital Foundation. This week, she's giving us a brief update on the situation at the hospital, and then comparing and contrasting the polio epidemic of the 1950s to our situation today.
Hello, everyone. I am so glad to be back on Nevada County Now again this week and want to share a little bit about what's going on at Sierra Nevada Memorial Hospital and Sierra Nevada Memorial Hospital Foundation. Right now, of course, the thing on everyone's mind that they want to talk about is the vaccine and how to get it. And there's a lot of confusing information out there, but I will tell you that for the community-wide vaccinations, the county, Nevada County, is actually in charge of that, and they are working on a plan, and you can find that information either through the county report, if it's on this episode as well, or if not, you can go to mynevadacounty.org, and you can go to the vaccination section. There's also a section about volunteering, which is something that a lot of people have asked about, so that's another great place to go. And I know that they're providing updates as fast as they can. Meanwhile, at the hospital, things are looking a little better right now at the hospital as we're seeing cases within the hospital go down just a little bit. There was a tremendous kind of surge after, December and early January. Today, I thought it'd be interesting to share something that I wrote about recently for the union. And I hadn't seen it anywhere else. But if you're a seasoned adult, you may remember the most feared epidemic of the 1950s. That, of course, was polio. Polio paralyzed and debilitated thousands of children and adults. And while there are differences between polio and COVID-19, there are also many comparisons that can be made, and probably a lot of things we can learn from them. First of all, both epidemics are viruses, albeit that both viruses have different origins. Most of us know that COVID-19 is a respiratory virus, while polio is an intestinal virus. COVID-19 damages the lungs, as we know, but polio migrated into the spinal cord and destroyed the motor nerves, primarily causing the paralysis more than death. Polio is primarily debilitating, but there were a lot of lives lost during the polio epidemic. And it spread person to person, but it was more prevalent in regions and areas that had challenging sanitation issues. Another difference between the two is polio dates back centuries, although it really appeared in Europe in the 1900s, and then at its peak in Europe and the United States in the 1940s and 50s, where at that time it paralyzed or killed over 500,000 people worldwide a year. COVID has been found in humans and animals, whereas polio is primarily a human disease. While the victims of polio are very dissimilar from that of COVID, polio affects primarily children, although people like President Franklin Roosevelt did contract polio. It was a younger audience or younger patient group, and polio's original name was actually infantile paralysis. It could be fatal if it affected the breathing muscles, although much more often it caused paralysis. Generally, COVID-19 can, affect all ages, but we do know that it is most prevalent in older adults and tends to be more serious for those with chronic health conditions. A similarity in both diseases is many people are asymptomatic, meaning that they don't exhibit symptoms, but they are capable of spreading the disease. The Center of Disease Control and Prevention, the CDC, estimates that 25% of COVID-19 patients were asymptomatic, where interestingly enough, over 90% of polio cases were asymptomatic. A commonality between the two epidemics is that asymptomatic individuals were the major source of new infections in both cases. So a difference also with the two is that polio tended to hit one region at a time, whereas we all know we were all hit with COVID-19 throughout all 50 states almost at the same time. Because polio's impact was more prevalent with children, interestingly enough, it didn't have the same economic devastation at the time that we're seeing right now, because the older adults, the wage earners and the businesses at that point were able to keep up and keep working. Just as hospitals today are struggling to care for COVID-19 patients, some similarities are that in the hardest years of polio, the hospitals were equally overwhelmed by very similar things: overcrowding, lack of supplies, concern about staffing, the things that our hospitals are all worried about today. And isolation hospitals were set up. And just as we have today's strict visitor policies, back in the polio years, there were very, very strict visitor policies there as well. And some of you will remember this term, the widely feared iron lungs, which were the first effective ventilators that saved many lives. But interestingly enough, during that time, doctors had to do what they've had to do in some parts of the country with the COVID-19 and the ventilators, and that's make very difficult decisions about who could use the ventilators or who could use the iron lungs based on the fact there were very limited supplies of both. Rotary, which is an international community service club that most people have heard of, united about 35 years ago with the idea of they were going to focus on the eradication of polio worldwide. Internationally, the clubs have donated over $2.1 billion and vaccinated nearly 3 billion children in 122 countries from the paralyzing disease. Their work with others around the world, in large part, are the reason that polio remains endemic in only 2 countries now, Afghanistan and Pakistan. The key, which is going to be similar with COVID-19, is vaccination. Locally, all 5 clubs are still very involved in the eradication of polio worldwide, but the clubs are all stepping up right now and asking in our own community how they can help with COVID-19. 2 very, very different epidemics and 2 very different eras. And while we wish we could have quick fix answers, just as medical research ended devastating decades of polio, Our scientists and medical professionals today are really working hard to develop vaccines and effective treatments that are hopefully going to give us a COVID-free future. Thank you for listening. I'm Kimberly Parker, Executive Director for Sierra Nevada Memorial Hospital Foundation. For more information on the work we do, please go to www.supportsierranevada.org, or you can email us at info@snmhf@dignityhealth.org, or call us at 530-477-9700. Until next time, stay healthy, stay safe, and please stay masked. Bye-bye.
Thanks, Kimberly. Last week, the Nevada County Relief Fund announced another round of funding for 73 local businesses. Sonora Slater spoke with a few recipients of this funding to find out how this money will help their businesses.
Thanks, Cole. The Nevada County Relief Fund was established in April 2020 in order to mitigate the impact of the COVID-19 crisis on local businesses. Created through a partnership between the County of Nevada, Sierra Nevada Memorial Hospital Foundation, Tahoe Truckee Community Foundation, the Sierra Business Council, Center for Nonprofit Leadership, and the Economic Resource Council. The fourth round of microgrants was recently awarded to 73 small businesses countywide, with the funds raised by local donors and community leaders. While this fund only issued microgrants, the businesses that were selected to receive money expressed how important the relief fund is going to be to them and their operations. We went to downtown Grass Valley earlier this week to talk to a few of these business owners.
Could you just talk about some of the struggles that your business has faced during COVID, and just kind of like why the relief fund was important to your business?
The relief fund was outrageously just such a blessing for this second time of being shut down. First time around, it was hard, but my landlord worked with me and, I got through it. But this time I had never really recovered completely from the first time. So this time it was, just so abrupt and didn't have time to do anything to save or anything. Oh, the donors, thank you so much. It's just a blessing that people are so generous. And, we just got a generous town anyway. And being born and raised here and watching everything that's gone on all these years, people are genuine. So thank you guys for doing it. I really appreciate it. It's going to really help.
Yeah, I think that we are particularly lucky here in Grass Valley because we have a local community that really supports small business. I had a number of people come in over the course of the last few months since we reopened and say that they were, specifically not going for big online businesses this Christmas and other things like that. So we've been kind of lucky compared to some of the businesses I know in town and elsewhere. This grant will really be helpful for me to not only pay rent and simple bills, but also to build the inventory, which I have not been able to do since after Christmas, because we had a good, relatively good considering COVID holiday season. Our inventory is down, and so it would be nice to be able to build that back up, which is something I can't do right now because of the lack of funds. It really comes back to the community supporting the community. We've had, tremendous amounts of outpouring of love and funds and help from the community, which is how we get these kind of grants. And so we're grateful to everybody who participated.
We also talked to a few other businesses that we weren't able to get to in person, including Grass Valley's Moms and Minis, owned by Emily Rangel. According to Emily, the shutdown in March came around the end of her first year in business, and so her lack of experience contributed to the struggles COVID-19 presented Moms and Minis. She said that they will use the grant to cover payroll and rent for the next month, and wanted to thank the community for supporting local businesses and allowing business owners to keep their dreams alive. "It's huge for us," Emily said. "I definitely cried when I received the email." We also talked to Sierra Symmetry, a Pilates studio in Truckee that has faced long closures due to its classification as a gym. According to the studio owner, Sherry Smith, They have high rent and utility bills that the grant will help cover. She thanked the community for their support. If you would like to make a contribution to the Relief Fund, you can go to nevcorelief.org/donate. Back to you, Cole.
Thanks, Honora. To start the new year, the Nevada County Board of Supervisors has done their regular reshuffling of leadership roles. Former Chair Heidi Hall has transitioned back to a regular board member, Vice Chair Dan Miller is now board chair, and Sue Hook is the new vice chair. I spoke with new chair Dan Miller about the plans and goals of the board for the coming year. All right, I'm joined today by District 3 Supervisor and now board chair, Dan Miller. Thanks for joining us today, Dan.
Cool, my pleasure.
And congratulations on your new position.
Thank you. Second time around for me on this position. So, I got my feet wet in 2016.
Gotcha.
So just a nice little rotation we have here at the board.
Yeah, that's what I was going to ask about first, I think, is for people that may not be aware, how does one become chair of the board? How does that situation work?
Yeah, it typically is on a rotational basis. And the last year I was vice chair, Supervisor Hall was chair, and you rotate the districts. Boy, it goes from 3, it goes from 1 to 3 to 2 to 4 to 5.
Gotcha. So do you have any particular sort of pet topics or things that you're hoping to get on the agenda there next week?
Well, housing is my kind of niche right now because I'm on the Regional Housing Authority. And so we got and it was amazing that we've been a member since about 2005, 2010. And the Housing Authority had never done a low-income housing project in Nevada County.
Wow.
And so when I got on the board, it was like, this is a no do nothing board. We'll give it to Miller. And so I went down there. I realized, oh, wait a second. All these projects that this housing authority is doing in Yuba City and Sutter County and Live Oak. And I said, we don't have any of that. And so we immediately started doing it. And Hank Weston, who was the district 4 supervisor, and I teamed up, found a piece of land in Penn Valley. And that finally got a senior low-income housing project that's almost complete. We've partnered with one up in Truckee, the Artist Lofts. We're starting the construction of the one Brunswick Commons in Grass Valley. And then we're looking at Cash and Field. So there's 4 projects that in the last 5 years, all of a sudden, Nevada County is starting to really put together low-income housing that is desperately needed. Get the homeless out of the woods, put them into housing, let them work on their issues. So housing is kind of my niche, and that'll be talked about in the second day of our workshop.
So circling back to COVID a little bit and the pandemic, I know you were at the memorial on Tuesday. Do you have any thoughts that you would like to share about that or the current situation that we're in?
It's frustrating for us because we're not getting the allotment that is necessary. And I was reading the Sacramento Bee this morning where El Dorado has really received a nice distribution in their county, and we're just not getting that distribution. And so I'm not quite sure how the state's doing it. I know the federal government, they go to the pharmacies, the state goes to the hospitals, and it doesn't seem like those two arms of government are coordinating with one another. And so consequently, there's counties that get left out, and I think we're falling through the cracks somehow. And that's something that we've got RCRC staff working on along with our state legislators because of that inequity as far as the distribution.
Absolutely. Well, do you have anything else that you'd like to share, or you think the community needs to know about from your perspective at the moment?
No, I think people need to know the board is trying to work with the cities. We're trying to coordinate all our efforts. If we don't have the answers, it's because the answers haven't been given to us, but we're looking for As far as the COVID, just there's so many unknowns out there, and protocols. Do you wear a mask? Do you don't wear a mask? I hate smelling my breath, but I'm going to wear a mask just out of respect for the people who really do have a genuine fear for what we're going through. Social distancing. I'm still not on board with the restaurants being closed. And I would like more local control. And I think the supervisors throughout the state would like more local control, because we were elected to represent the people of Nevada County or other counties. And we're not given that authority. That authority's been taken away from us. And who knows our county better than us?
Thanks, Dan. And again, to view my full conversation with Dan Miller, visit us on Facebook or YouTube. Wet weather has returned to our area. The National Weather Service in Sacramento has issued a winter weather advisory until 10 p.m. tonight. Watch for slippery roads, travel delays, and possible chain controls over the Northern Sierra. If you have mountain travel plans today or over the weekend, be prepared for winter driving conditions. Slow down and give yourself some extra time. Pack emergency supplies, and if visibility is an issue, just pull over in a safe place and wait it out. The National Weather Service in Sacramento is projecting a mostly clear day on Saturday, but the wet and snowy weather is set to return on Sunday and continue into the beginning of the week. Snow levels are listed as low as 1,000 feet in the Sierras over Sunday night and into Monday morning. If you have anything to do outside over the weekend, Saturday is likely to be your best bet. And if you're looking to take advantage of the slightly nicer weather on Saturday to get out and pick up some fresh produce in between farmers markets, First Rain Farm has a farm stand available this Saturday, the 23rd. First Rain Farm is partnering with Sunrock Farm and Chapman Farm to offer this fresh produce. They will be open from 11 to 2 on Saturday, and it takes place at First Rain Farm at 19832 Rector Road, Nevada City. To find out more about First Rain Farm, visit their website, firstrainfarm.com. On Tuesday, January 19th, the Nevada County COVID Memorial Group unveiled a memorial to honor the local lives lost to COVID-19. A cross was placed on the hillside above Old Barn Self-Storage to honor each victim. The Nevada County COVID Memorial was attended by multi-denominational clergy, the press, local officials, and family members of some of the victims. The event was organized by the COVID Memorial Group, a grassroots team of local residents who have come together to create this memorial to show support for the families of those we have lost to COVID-19. We'll leave you this evening with a short bit of footage from this event, and as always, our thoughts are with the families that have been affected. Remember, stay safe, take care of each other. We'll see you next week.
This memorial honors the lives of those community members that we have lost to COVID and to their families. We recognize that many of the families were unable to be with their loved ones, and we want to give them a memorial to offer our compassion, support, and caring.
Good afternoon. I am Reverend Rafe Ellis, and I am the Senior Minister at Sierra Center for Spiritual Living. The author Leo Buscaglia wrote that as human beings, we are to love, live, and leave a legacy. Especially to the family members, you are the legacy. And while I don't personally know your loved ones, I have no doubt that they loved and that they lived. The fact that you're here is evidence of all three of those.
Giving us the honor of participating in this. One of the most difficult times we're facing now is the ability to come together. To come together as families, to share in our grief, to share in the stories and the memories of those we hold dear and had no idea we would lose them so quickly and under these circumstances.
I want to thank you all so much for just the wonderful invitation to be here and to be able to share with you. I'm truly honored to be a part of this gathering, and I just want to express my sorrow for you who have experienced loss. Just so sorry for all of you who have lost someone you love, someone you care for.